Actually, lifestyle factors do affect skin health a lot, but first we have to understand the process of aging first in order to prevent skin aging. There are two main mechanisms that contribute to aging process. First is the accumulation of free radicals, and second is the molecular inflammation. Both processes are going on inside our body every day, all the time. So in order to prevent aging, we have to try to slow down these two processes. So some lifestyle factors do better, like help us combat with these two processes. And whereas some lifestyle factors put negative effect on these two processes. First and the most important one is diet. Studies show that if your diet mainly composed of foods that are high in antioxidant and anti-inflammation property, that will help combat with the free radical and the inflammation. So it will slow down the process of aging of skin. On the other hand, if your diet mainly are food that have pro-inflammatory property, for example, if your diet mainly composed of deep fried food, sugar, sweet beverage, refined carbohydrate, or processed meat, that will kind of make your body have a lot of inflammation, molecular inflammation that is invisible but going on. So the diet is your choice. You can choose to have a good diet to affect your skin health, or you can choose to have the diet that destroys your skin health. Other important factors is exercise. Study shows that exercise helps balance your hormone. So people who do exercise regularly will have overall better skin quality. Other lifestyle factors worth mentioning are lack of sleep or chronic sleep deprivation that can put negative effect on your skin health, stress, chronic alcohol consumption, and smoking, and too much sun exposure. The Vacation Facelift program is the innovative program that is designed by the dermatologists and anti-aging doctors in Samitivej Sukhumvit Hospital. The program combines the skin treatment and the anti-aging treatment. For the skin treatment, we provide the no-needle facelift procedure, and for the anti-aging treatment, we provide the blood testing to test for internal markers for aging, for example, free radical level, inflammation level, and micronutrient level. And we can provide the lifestyle modification plan according to the patient's need, and also IV nutrition in case needed too. The no-needle facelift procedure is cutting-edge technology that uses high air pressure to bring the hyaluronic acid deep into the skin through the tiny entry point. Once the hyaluronic acid was placed underneath the skin, it will attract water into the skin. That will result in lifting effect. And also it will make the skin kind of plump up and have better quality, less wrinkle, reduced pore size. And also the jet pressure, when it's spreading into the skin, that creates micro trauma for the skin. So it will stimulate the skin cell to produce more collagen, and over time you will have like gradually more collagen and less wrinkle 2 to 3 months after the procedure. The no-needle facelift procedure, it does cause some kind of, as I said, it's a micro trauma to the skin. So you cannot do it too often because it's caused some stress to the skin. Same way as some laser procedure or some high intensive ultrasound procedure that create the micro trauma to the skin. You cannot do that too often too. In general, people who is at risk of vitamin deficiency are people who have very restricted diet. For example, strict vegetarian, or people who are chronic alcohol consumption, or people who have disease that affect gut absorption, or people who are very limited, who have very limited sun exposure, or people who taking some medications. In general, these are people who is at risk of vitamin deficiency. In case of Thailand, the common vitamin deficiency here in Thailand is vitamin D. Studies show that 1/3 in Thai postmenopausal women have vitamin D deficiency. And vitamin D deficiency can result in impaired bone formation, so it increases risk of osteoporosis. And it can make you feel fatigue and lack of energy, or even their studies show relationship with depression too. So the people with at risk of vitamin D deficiency is people who are obese, who are old age, or who have very limited sun exposure, who have dark skin tone, and also who have some medical conditions. When the patient come here for the anti-aging treatment, we usually start with the history taking to know the patient's problem and their lifestyle. And then we send them to have the blood testing done. The blood testing will show how they age from inside, show the markers for aging, and show the vitamin levels. Once we get the result, we'll have a discussion with the patient and design the plan for them, like together, to have lifestyle modification plan to improve their health. And in some case, for example, if the patient result show that they have vitamin D deficiency or vitamin B12 deficiency or suboptimal level of vitamin C, the doctor gonna prescribe the customized supplement. So that supplement will be formulated according to the patient's need and the patient's blood test result. And that will so the patient will get the supplement that is like according to their needs, specially designed for them. It will be different from over-the-counter supplement. Vitamin act as either the catalyst or the precursor for protein synthesis in the body, and collagen is one of the structural protein in the skin, right? So if we would like to slow down the collagen breakdown, or would like to encourage the collagen formation, we have to make sure that we have enough of the crucial nutrient. In case of collagen, vitamin C and some amino acids are very crucial for collagen formation. So before the patient decide to have any procedure done to combat the wrinkles, either the laser procedure or even the no needle facelift procedure that I mentioned before, they have to make sure that they have enough of the good vitamin and nutrient level in order to have the procedure and have the satisfactory result. Yeah, it's good if they already have the good diet, like 5 servings of fruit and vegetable every day, and they don't smoke, they don't drink. I can assume that they should have enough of the good nutrient for collagen in order to produce the collagen. But if they don't, or they may have other factors that may kind of inhibit the nutrient absorption, or they smoke, or they have any other factors, they can make sure by having the blood testing done. You cannot just rely on supplement. I mean, diet and exercise and sleep are still the very important thing, like a main pillar for healthy aging. You cannot rely on supplement only, yes. Patients, it's okay to take supplement every day, but they have difficulty in terms of change their diet. Yeah, that's the most often problem that I encounter. I think first they have to set the goal first. Why they want to become healthy, why they want to lose weight, or why they want to prevent aging process. They have to have a solid goal. Once they set the goal, and they may kind of write down the objective, so that has like something very, very solid and to remind them. And once they have a goal, and then they should try to set a solid plan about how to change their habit to be healthier. Maybe start with talking with the doctor. Actually, not necessary that have to be the anti-aging doctor, or not necessary to be here. Any doctor should be able to give them the advice of how to be healthy. And I think they should search for information about diet. Actually, I think they can search a lot in the internet. You can Google and find a very informative data about how to be healthier, about diet. And once they get the information and have a talk with the expert or the doctor, and then they can write down the plan how to change their diet to be healthier. Also, same thing as exercise. A lot of people want to kind of maybe almost every New Year Eve, people like to have like a New Year resolution to, okay, this year I'm gonna exercise more. I'm gonna start exercise. But I think most of the time they fail, right? So you have to have very, very solid plan. For example, you are going to exercise on Monday, Wednesday, and Friday. Or you know your schedule. For example, you start working at 8, and normally you wake up at 6. So you may have to promise with yourself to wake up at 5 so that you have 1 hour extra to start exercise. Yeah, I think so. Basically, you gotta have the inspiration, you gotta have the data, and then you have to have the solid plan. And then you are all set to go for living a healthier life. For the environmental factors that affect the skin health, I think the first and the most important one is sunlight. Because in sunlight, there are UVA, UVB, and also infrared and visible light. So all 4 spectrum of light contribute to skin aging because it creates the free radicals and also inflammation in the deep layer of the skin and destroy the collagen. So collagen is like a protein that acts like the supporting structure for your skin, right? So once it breaks down, your skin grows older. So I think the first and the most important factor in terms of environment is the sunlight. So the usually number one advice from the dermatologist is to put on sunscreen, right? Another important factor is air pollution. Also, air pollution creates free radicals in your body, so that make you age from inside too. And I think that's the factor that people sometimes forget to think about it. Caucasian who happen to live in tropical country, for example, Caucasian who have been living in Thailand, they have more sun-damaged skin and have higher risk of skin cancer because they have fair skin, right? And so they don't have the melanin to protect their skin. And then they have to live in like country like Thailand, which the UV index is very high. So I think that is a very good example of how environment affects the skin. Find time to, like on the weekend, find time to get out of the city to get some fresh air. And also try to keep your diet healthy, because at least you may have a lot of free radical formation from the environment, but at least your diet composed mainly of antioxidant, so that will help balance or at least combat the free radicals. For people who have eczema or even psoriasis, it's quite difficult in terms of the traditional procedure, for example, surgical facelift, which create the open wound on the skin. Because once we create the open wound, there's a risk that we exacerbate the symptom of psoriasis, right? But with the innovative technology that is less invasive, for example, the no needle facelift, I think the risk of exacerbate the disease, for example, psoriasis or eczema, is quite low. So I think comparing to the traditional procedure, it's safer, but I cannot tell that it's 100% safe.